My name is Carol Bond, and I am your MC for today. We would like to acknowledge the Wurundjeri and Bunurong people of the Kulin Nation and also pay our respects to elders past, present, and emerging, and extend that respect to all Indigenous Australians with us today. Welcome to our hybrid meeting for those online and in the room. Today's thanks will be given by past President Robert Fisher, followed by the loyal toast presented by President Philip Cornish. Please ensure that your glass is charged.
Rotary is renowned for its active involvement in community service projects that aim to enhance the lives of people who live there. These projects include support for marginalised youth, people with disabilities, the homeless, and other disadvantaged individuals. We give hands-on help and offer more strategic support such as mentoring, planning and leadership. That's what Rotarians around the world do every day. Today we acknowledge and celebrate someone who has given exceptional service to East African communities in Melbourne West. Dr. Fatun Farah, who unfortunately cannot be with us today in person, is the chairperson of the East African Women's Foundation, which she formed in 2007. Dr. Farah has supported women, particularly migrants new to Australia, by providing advocacy and referral services and engaging them in cultural and community activities. They have formed a shared community and built a local support network while retaining and celebrating their cultural heritage. This is a wonderful example of community service in action. So for good food and friendships through Rotary, we give thanks.
Rotarians and guests, a toast to Australia and Rotary International. Thank you. Please be seated. We'll be breaking for lunch and we'll reconvene at 1:10. For those online, please take up the offer of a Zoom breakout rooms which will open shortly. Thank you for that warm welcome. Members, visitors and guests, it's my great pleasure to, can you believe it, welcome you to our 22nd meeting of the Rotary year and our 5,105th club meeting in our 105-year history. It's a great day in our club's calendar, the awarding of the Sir John Reid Community Service Award. Very sadly, I have to tell Rotarians and guests that this morning we learnt that our 2025 recipient, Fatun Farah, would not be able to attend due to the unexpected death of her father this morning. We extend our deepest sympathies to Fatun and the extended family and indeed the foundation of which she was so important. Fatun has still kindly organised a spokesperson who is joining us today. Please welcome Sadaya Ahmed. Sadaya. And accompanying Sadaya are colleagues from the East African Women's Foundation. Tanya Magika, Madifa Mohammed and Sada Hashi. Would you please join me in acknowledging and making them all welcome? Also here as guests we have Belinda Lawson and Kay Mackenzie, granddaughters of Sir John Reid, who of course was a very prominent past president of this club. And joining us online is Margaret Ross, daughter of Sir John Reid with her husband and club member Ian Ross. Please join me in making all of our award guests welcome. Joining us, hosted by Jeremy Oates, we have Julie Hamlin and Wendy Brooks. Julie is the chair of Malik Timor, an organisation dedicated to healthcare in East Timor. We'll be hearing from her shortly. In the meantime, could you both make them welcome, please? We have other visiting Rotarians, visitors and guests and members. I invite you and your host to stand when your name is announced and ask that you please remain standing to enable you to be welcomed in a collective manner, and can I assure you, you'll all get an equal share of the applause when it occurs. So, visiting today, we have Santiago Parsons Urboni, Santiago, there we are, and Antonio Parsons from Buenos Aires in Argentina. Atty Mildred is Martinez Tria from the Lubang Island Philippines Club. And visiting Rotarians, I'm very pleased to say that we've got Ian Bentley, President of the Hawthorn Rotary Club, Dorothy Gilmore, Aminda Bell and Jane Bentley, all from Hawthorn. And I'd like to especially acknowledge you and your efforts with our partnership in the Safe Families program, so thank you very much. And we have Eboya Akabini from Wyndham Harbour. There we are, lovely to see you. Also here today we have Alexa Hermoso and Lynn Brillo, who are guests of Peter Dakin, Amanda Bettini, a guest of Tony Bettini, Jessica Zerich, a guest of Dibyang Fu. So, round of applause for everyone. So, this Friday is East Timor Independence Day. Our club members have taken a keen interest in rebuilding and growth of this young nation. Amongst them, our own Professor Jeremy Oates, who has delivered training to East Timor midwives and health professionals for the improvement of maternal and child outcomes. Starting in 2011, Jeremy led 17 volunteer visits to remote regions of Timor Lesté, typically of 6 to 10 days duration, to deliver upskill training to 360 midwives, nurses and 162 doctors. Funding was from Rotary International Global Grants. Past President Bob Glinderman reminded us that in November, Rotary Foundation Month, we highlight the support of a foundation of Rotary projects. I call on Jeremy to come to the podium and further introduce Julie Hamblin, who has recently returned from East Timor, to provide us with an update on East Timor health. Thank you, Jeremy. Yep.
President Phillip, Rotarians and guests, it's my privilege to introduce Julie Hamblin and Wendy Brooks from the Malik Timor organisation, whose function is to improve clinical care, innovative healthcare and maternal and child health, TB, nutrition, family medicine in Timor Lesté. Julie Hamblin is the chair of Malik Timor. Incidentally, is also on the board of the Royal Australian New Zealand College of ONG, and she was a Rotarian scholar as well, so has a long contact with Rotary. And Wendy Brooks' company provides strategic fundraising advice to non-profits. She was the director of the foundation of the Royal Women's Hospital, which I think is what trained her for this role. So it's a great pleasure to invite, and particularly I think Julie's going to tell us a little bit more about.
Thank you so much, Jeremy, and thank you all for such a warm welcome. It really is a pleasure to be here. And as Jeremy mentioned, I do have a particular Rotary connection because many years ago, I was the very fortunate recipient of a Rotary scholarship that allowed me to go to McGill University, which is where I did a Master's in Health Law and Ethics. And that was what launched me into a career in the health sector and also started my interest in global health, which is something that I've been able to follow through since then. So I had a lot to do with Rotary in those years. I haven't had so much in recent times, but it's left me with a great affection and a great respect for the organisation and the wonderful work that you do. So it makes it a double pleasure to be here today, and thank you, Jeremy, for inviting us and for making it happen. As you heard, it is East Timorese Independence Day very soon, and I'm really delighted to have an opportunity to talk to you a little bit about the Timor Lesté that I know and the work that we do through Malik Timor. It's an association that for me has been incredibly rewarding, and the work is difficult. There is still a lot to be done, but it's certainly, I feel, one of the most worthwhile things that I've done. And I'm grateful to all of you for the opportunity to speak and for your interest in Timor Lesté. I know there are people in the room who have spent time there and know a lot about the history, but let me just say a couple of words briefly about this very young and challenged country. So I'm sure you know East Timor, as it was then called, was occupied by the Indonesians following a very brutal invasion in 1975, and a very brutal occupation for the following 25 years until there was a change of regime in Indonesia, an independence referendum, and the Timorese overwhelmingly voted to form their own country, and that happened in 2002. They were at that time the youngest country in the world. I think they've been now taken over by South Sudan, but they are still a very young country, and you have that feeling of sort of a young country trying to make its way in the world when you go there. I have to say, the first time that I went there, though, I was completely shocked at the needs there. I know the health sector in particular, but the needs across the board in Timor-Leste are profound. It's an hour from Darwin, and I think all of us as Australians should feel a responsibility to Timor because it is such a near neighbour, it's had such a difficult recent history, and it is trying in a very, the people are trying in a very courageous way to build a country out of a difficult and traumatic history. It's very small. The population is about 1.4 million, and around about 70% of those people live outside the main cities. So extremely remote villages. The geography is steep mountains. Access is incredibly difficult. In the wet season, you often can't get, the roads become impassable. So there are those sort of geographic challenges. And the poverty is still profound in Timor. It's one of, if not the poorest countries in our region. 40-something% of people in Timor are still below the poverty line. One of the most shocking statistics, and it actually becomes quite visible on the streets of Dili, is that 45% of children still experience stunting just through malnutrition. And that's a combination of food scarcity, of difficult practices and simple poverty. The GDP of Timor is lower than sub-Saharan Africa, and it's this country on our doorstep, and I think many of us, and I certainly didn't know that until I went there, just what the needs are in Timor and how profound they are. In the health area, just to give you a snapshot of a few things that I think tell a much larger and concerning story. Maternal mortality is still incredibly high in Timor, despite the efforts of Jeremy and his colleagues to improve the standard of obstetric care. A Timorese woman is 30 or 40 times more likely to die in childbirth than an Australian woman. Neonatal mortality is still incredibly high. 1 in 20 children die before the age of 5. And there are still highly preventable diseases that are endemic in Timor. It has one of the highest prevalences of tuberculosis in the world. Tuberculosis is actually the highest, the major source of cause of death in Timor. Rheumatic heart disease, completely preventable, which causes a terrible loss of life of people in their most productive years. Rheumatic heart disease is still very, very prevalent in Timor. So there are an enormous number of health challenges, and that was what drew me into doing the work. But I don't want to just talk about the negative side, because there is lots that is positive too. What Timor has is a young and enthusiastic population that are so proud of their country. 2/3 of the population of Timor is under the age of 30, which is a pretty astonishing figure when you think about it. Now, part of that is because of the terrible loss of life that happened during the Indonesian occupation. Part of it is a very high birth rate now. But the median age in Timor is 21. So you have a whole generation of young Timorese coming through. It has challenges, social challenges, to find work, to find ways for them to live in Timor. But it also has this workforce of young, proud Timorese that we in Malik Timor are able to draw upon for the work that we do. So we work in primary healthcare. We initially were looking at setting up a separate clinic, and we decided that that was the wrong way to go, that what we needed to do as Australians was to find a way to support the Timorese workforce. So Malik Timor is a Timorese-owned and led organisation which we support from Australia. We were just able to appoint our first Timorese Executive Director earlier in the year, which was really exciting. And we have a memorandum of understanding with the Ministry of Health, and so we work with the Ministry of Health alongside the Timorese workforce to try and build their knowledge and skills and capacity to deliver the healthcare that they need. And why primary care? Because, as I said, the population is so dispersed. It's out in the villages. They're a long way from hospitals. They're not going to be able to access the health facilities that are there. So it's the local health workforce that is going to make the difference in areas around preventing rheumatic heart disease, providing professional skilled support for mothers who are delivering babies in Timor. We work across a number of disease streams: tuberculosis, rheumatic heart disease. We try and get the penicillin treatment out that will prevent the development of rheumatic heart disease. We have a big oral health program. There are very, very few dentists in Timor, and of course poor oral health has a cascading effect in terms of other health issues. We have a small maternal and child health program. We run an HIV clinic in Dili that is one of the few that actually is able to retain patients and give them the treatment they need. So we do all this because we have 60 Timorese staff who are young and keen and who are just a delight to work with. And so I'm very happy to extend an invitation to all of you to come to Timor if you would like to learn more. Every year we organise a trip for people who are interested, friends, supporters, to come to Timor. I would really urge you to learn some more about this country. I do have a brochure about our work, which I would like to hand out for those of you who are interested. But thank you again for the opportunity to speak. Thank you for your interest in Timor and for your hospitality today. Thank you.
Okay, so thanks Julie, that was terrific, and thanks also to Jeremy for all your work over there on our behalf, so that's terrific. Anniversary. I don't think is Peter Addison here today? He's 20 years anniversary today, so that gives us time to shine a light on one of our quiet achievers who celebrates her birthday today. Associate Professor Rosemary Nixon AM. Rosemary graduated in medicine from Monash University in 1981 and became a Fellow of the Australasian College of Dermatologists in 1988. Yes. She's worked in... it is on the internet, but the internet's not always reliable, but
Make it a bit quicker than that.
General dermatology for more than 30 years, now practices privately in Carlton. She's she's widely respected for her expertise in occupational dermatitis, where she made a distinguished and lasting contribution. So if your job gives you a rash, Rosemary is exactly who you need to see. So Rosemary was appointed a member of the Order of Australia in 2017 for her significant service to community health in the field of occupational dermatology as an academic researcher and a leader in professional standards. Outside her professional and Rotary life, Rosemary is a mother of 2 adult daughters and an avid hiker, regularly travelling the world in search of new trails and adventure. Rosemary was inducted into our club on the 29th of March 2017, and true to form, she hit the ground running. She's been president of she's a great volunteer, president of the Skin and Health Institute, long-time supporter of the Scouts, and in Rotary is an enthusiastic contribution to every volunteering opportunity, runs our footing tipping competition on track, even though she's a Hawthorn person, and she currently serves as a group captain for the Kew North Woolwyn Group and is on our board as Director of Community Services. So please join me in wishing Rosemary a very happy birthday and thanking her and everything she brings to our club with good humour and great energy. So now, Maestro.
Oh, he's not ready yet.
Not ready.
Thanks, Phil.
Happy birthday to you. Happy birthday to you. Happy birthday, dear Rosemary. Happy birthday to you.
Hip hip. Hooray! Hip hip. Hooray! Hip hip. Hooray!
Smith family raffle is on. A reminder, could either Jim, do you want to come up and just let us know what we're doing and how we can contribute? Thanks, Jim.
Thank you, Philip. I will draw your attention to the brochure on your tables, particularly visitors who might not have seen it over the past weeks. Raising money for the Smith family has been one of Rotary Club of Melbourne's major projects for over 20 years. We've heard today about all sorts of great people doing important things, both within Rotary and more broadly, but in addition to those, we think that the work the Smith family does to support the education for kids from underprivileged families is a great project and sort of underpins sort of alleviating problems, you know, before they start potentially. So if you would be so kind, if you could buy some raffle tickets. Trevor will be at the table at the back selling some tickets on the way out. We also have, as you will have seen from the brochure, the aforementioned brochure, there is a, whatever you call those things?
A QR code.
QR code, thank you. So if you zap that, we can take your money that way as well. The prize is $2,000 gift voucher from My Ride Cycling Store in Wellington Street, Collingwood. So that can be $2,000 towards a $10,000 bike or 10 $200 bikes, if I've got my maths right there, so it can be spent whatever way you want. And as per the picture, showing the brochure for the third time, links in well with Christmas, so if you were the lucky winner, poultice of Christmas presents for yourself, for kids, for grandkids. Thank you very much.
Thanks, Jim. Just a reminder that our annual Christmas appeal this year is for Homie. Nick Pearce is the founder of it and was one of our Young Achiever Awards. They're a social enterprise. They do clothing, streetwear, and they get young kids into jobs. They've got an 85% success rate. The first job most young people have in Australia is in retail. So it's a very good route into an employment history, and it's much better to get homeless kids into jobs so they can support themselves than providing long-term support and care. And I have to keep apologising to Nick Pearce, the founder, because I keep getting his name mixed up with the Lord Mayor of Melbourne, Nick Rees. So it is Nick Pearce who's done it, so thank you. So we've got a draw of a raffle. Thanks. I think we've got two prizes today, and I'll draw the more unusual one first. For toy plane. I know you're all looking forward to winning this one. So D60 blue. Well done. Well done. Take back to Germany on a visit. So. knocked a few out there. And it's another blue. I did go deeper into the pile, so it's blue D57. Well done. And I now call on our Chair of the Day, Tony Bettini, to take over today's meeting. Thanks, Tony.
Thank you, Philip. Look, just before I begin, I'll read a text that I received this morning. Dear Tony, I'm writing to inform you that my father has sadly passed away. Because of this, I'm unable to attend the ceremony. I'm deeply honoured to receive the Sir John Reid Community Service Award. I would like to sincerely thank the Rotary Club of Melbourne for recognising our work. I truly appreciate this award and the acknowledgement of our contribution to the community. Kind regards, Fatun. Amanda, my wife, and I went out to Braybrook, did a site visit and met Fatun and the team, and some of them are here today. And it's incredibly sad what's happened, but it's also, I think, going to be a wonderful thing for this organisation and for Fatun to receive this award. And today, when I finish speaking shortly, we'll have Sadia Ahmed, who's down here studying law. She's from Brisbane, down here studying law, loves Melbourne. She's been delegated by Fatun to read the speech that Fatun would have given. So we'll proceed in that way. So let me again particularly welcome our online attendees, Margaret, daughter of Sir John Reid, and Dr. Ian Ross, who's been a 52-year Rotarian. I also acknowledge Kay Mackenzie and Belinda Lawson, who are here representing the family. And do we have past recipients today? No. No, okay. I was asked to take on this task, and I didn't have much of an idea what was involved, and it's been actually a wonderful task. I've seen some fantastic organisations, and it's been an absolute pleasure to go and meet and talk to people who are making this voluntary contribution to the community. The Sir John Reid Community Service Award is going to be in its 40th year next year, so the first award was 1986. And the list of past recipients is testament to the transformational power and the importance of community volunteering in our society. Now, for their wise counsel and sound advice, I didn't do all this on my own. I thank Peter Berg, thank you Peter, Iqbal Khan, who's not here, and also the Community Welfare Committee chaired by Mary Barry. So all of those people and parts of our organisation were involved. And I also thank Amanda Bettini, who works in women's health and came out with me on that site visit, and that was very valuable in her discussions with Fatun. I'll read the citation, which is a very well-written citation. I wrote it. So the 2025-26 recipient of the Sir John Reid Community Service Award, Fatun Farrar, is a founder and chairperson of the East African Women's Foundation. The Foundation's a non-profit organisation incorporated in 2007, based at Braybrook. It delivers vital services to over 20,000 Cushitic speakers drawn from Somalia, Ethiopia, Djibouti and northern Kenya. So it's broader than just the Somali community. The Foundation's services include migrant and refugee resettlement, parenting workshops, youth mentoring, that's Sadia is part of that, women's health, elder support, cultural awareness programs and community celebrations. Fatun's vision in founding EAWF has ensured her community has access to reliable, consistent and high-quality essential services, and to programs which empower women, strengthen families, foster social cohesion, and increase youth resilience and build community unity. Fortune's volunteering has delivered significant benefit to her community. She's assisted hundreds of women newly arrived in Melbourne connect with a safe support network and gain access to targeted services. Fortune has assisted these women establish successful lives in a new homeland and yet retain and celebrate their cultural heritage. Fortune and her dedicated team have developed and implemented programs of real impact, addressing issues such as mental health and family violence. These programs include targeted information about how to source appropriate professional and business help, access to counselling services, and access and finding crisis support and safe housing. They've also formed partnerships with In Touch Multicultural Centre Against Family Violence and supported women at risk by connecting them with crisis services and long-term safety plans. For example, with the Western Bulldogs Community Foundation and Daughters of the West programs, Fortune has promoted health, resilience, well-being and the building of stronger community connections. Fortune's dedication as a volunteer is exceptional. For 18 years, she's given the EAWF up to 30 hours of her time a week. Her volunteering is characterised by compassion, collaboration, inclusion and unwavering commitment. Fortune's focus on healing, well-being and creating business opportunities for her community has ensured the Foundation's continuous growth, built its reputation, extended the range of programs available and continuously improved its operations. Fortune's outstanding contribution as a volunteer is a clear example of service above self. She has empowered women, supported youth and families, and fostered a strong sense of belonging within her community. Her work has built trust and strengthened connections, ensuring community members feel safe and confident to seek support. That's a citation that she'll receive. And let me just finish before I hand over to Sadoya. Fortune is considering using the donation received, which is part of the Sir John Reid Community Service Award, to deliver awareness and education programs. Specifically, she has planned a series of interventions aimed at addressing the issue of female genital mutilation through community education, reinforcement of the stipulations of Australian law, and provision of support to women and girl survivors. It's probably something we're not really aware of so much, and notwithstanding, the WHO estimate that there are over 230 million women in the world who have been on the receiving end of this process. So it's a wonderful initiative that they're going to take. So through this award, Rotary Club of Melbourne gains the opportunity to support the East African Women's Foundation and to unite for good. Thank you. Soraya, your turn. When you're 21, you have it on a device. When you're 73, you have it on paper.
That was a funny joke. Good afternoon, everyone. My name is Sadia, and I'm honoured to be reading this speech on behalf of Fortune, and I'm also honoured to be here with the fellow members of the East African Women's Foundation, Tanya Makita, Nadifa, and Saida as well. Fortune, who unfortunately couldn't be here with us today, sends her warmest greetings and gratitudes to you all. So from here on, I'll be reading her speech. My journey to this moment has been shaped by resilience, courage, and the love of my family. I came to Australia as a refugee, a single mother of 5 children from Somalia. After spending 7 years in refugee camps in Kenya, those experiences gave me strength, shaped my values, and taught me the meaning of community, the power of standing together, supporting one another, and lifting each other through hardship. Arriving in a new country was not easy. I faced language barriers, isolation, and the responsibility of caring for my children while navigating such unfamiliar systems. But I realized I was not alone. Many women carried these similar burdens silently, often without support or hope. This inspired me to create the East African Women's Foundation and the Elais Community Heritage Centre, safe spaces where women are heard, respected, and supported. Spaces where we work together to build harmony, understanding, and respect for every culture and faith. Over the years, I have witnessed young girls dancing proudly in their traditional clothing, elders sharing wisdom, women finding the courage to speak and to heal. These moments reminded me why this work truly matters. Receiving this award today is not just an honor for me, it is a recognition of every volunteer who has shaped this foundation. Every woman who has trusted us with her story. Every mother who holds her family together. Every elder who preserves their culture. And the young generations who carry our future. It is a recognition of every hand that has helped, every voice that has been heard, and every life touched by this work. This award inspires me to continue building programs that bring healing, empowerment, and hope. It reminds us that even small grassroots organizations can create meaningful change when communities come together in understanding, respect, and solidarity. I accept this award with a commitment to continue working with women who have experienced mental health challenges, the trauma of war, FGM, and women with disabilities, women who are often facing difficulties connecting and accessing support. I would like to sincerely thank both the John T. Reid Charitable Trust and the Rotary Club of Melbourne for selecting me for this award and for the generous grant provided to the East African Women's Foundation. Your support strengthens our programs and expands our capacity to reach more women, more families, and more communities that are in need. Together, we strive to create hope, empowerment, and harmony. Before I close, I want to share a short Somali saying that captures the spirit of today. Gacmo wadajir bay wax ku gooyaan, meaning hands that work together can cut through anything. This award is a living example of that truth. When communities, organizations, and families come together with compassion, respect, and shared purpose, there is no barrier too strong for us to overcome. Thank you. That's all.
Okay, it's my pleasure to present, on behalf of Fatoon, the award of the plaque, which is recast every year. So there we are. Photographers, have we got that? Can we see that? This way?
Yeah, to that side.
How's that?
I think they wanted it for a little bit.
No. Tanya, can you join me, please? Okay. So we've invited Tanya to field any questions that you may have about the foundation and the work that the foundation does. And I probably want to ask the first question. What's the biggest challenge that you've had to overcome there with the foundation? What's
the biggest challenge?
Yeah.
Oh, thank you. I did think about this question before I came, but I was thinking in terms of speaking for Fatun, and now that I'm on the spot, I feel like I don't know what to say. I'm sorry. The challenges are, I don't know how to describe it. I think that it's telling that it takes two of us to represent Fatun, because Fatun is indefatigable. She seems to constantly exist supporting the community day and night. People call her in the middle of the night when they're escaping violence or in distress, or a family member has died, or whatever it is. And the rest of us pick up the pieces and help her, but she's the face of the organisation, and she's the one who bears the burden. And I honestly believe she doesn't sleep. She just spends her time dreaming up the next activity and the next project that the organisation is going to embark. And my job, as her friend and previously her lawyer, I've recently retired, don't ask me any questions, was always to say, well, you can't do everything. I think that's probably her biggest challenge. She can't do everything, and she believes that she can, or she should be able to. So in recent years, she's focused much more on trying to develop the young people around her to get more support and to ensure the continuation of the organisation into the future. So young people like Sadia, we're the older generation, the defo.
Yes. Amy.
Could I just say, Tony, we could not have a better winner for this award than Fatun. And I've known Fatun for over 10 or 15 years. But my question today is in relation to FGM. And years ago, we worked together with other teams to develop a toolkit to eradicate female genital cutting. And I use cutting rather than mutilation purposefully. And Fatun's work is clearly highlighted. So I'm just wondering now, because I'm happy to see the shift move from service provision and looking at how we can help service providers, which is where I came in, to how we can help the community. And I wonder what is going on now in that space. Thank you.
No, thank you. Earlier this year, we had a launch. It was a very successful event, launching our vision for combating FGM/C. It was a truly beautiful and amazing event. Part of the whole process involved giving every person at the event a rose and asking them to pull off one petal, and then asking them to try and put it back. It was very moving. At the moment, what we have done is put together a submission to government, and Fatun continues to lobby government, particularly at the federal level, to seek funding to be able to undertake more work. Part of the problem, as I see it as a lawyer, is that although the laws are there and the framework is there to protect girls and children, it depends so much on individuals actually coming forward and speaking. There's been very few court cases that have been conducted against this practice, and it appears to me that in each case it was a family member who spoke up for the children. And, you know, I think that we could increase the awareness and increase the possibility of certain situations, authorities turning their mind to the issue. You know, so like a family law dispute where one parent wishes to take children overseas and the other parent is objecting, saying, well, what is the risk of this practice being conducted while those children are overseas? But the Australian law says that that is still against the law. The fact that you've gone to another country to have the practice done doesn't mean that it's therefore legal. I believe, and I'm not an expert on world law, but I believe that it's not actually legal in the countries that are predominantly practicing it anyway. But it is specifically a crime to take a child out of Australia with the intention of inflicting this on them. And the intention is proven if the child has been mutilated or cut. So, you know, there's no state of mind that needs to be brought into it. So we are hoping that we can get some funding and try and promote policy development sort of along the lines of the child safe legislation, getting people, certain organisations like lawyers and courts and maybe schools and doctors to actually turn their minds to this as an issue that needs to be addressed. And by talking about it in the community, particularly in the East African community, talking about it more and saying we don't condone it, we don't believe it has any merit, it is not supported by Islam. So to try and get those conversations happening and maybe get people within the East African community to accept that you can speak up and prevent it in future.
Thank you very much.
Thank you very much.
Thank you, Tanya. And a tough conversation, a tough topic, but one that's incredibly important. And I'm so pleased that the foundation may, it doesn't have to, but it may use some of the support from JT Reid to address that issue. So congratulations to you. That's our meeting just about. I thank Robert Fisher for the reflection, Carol Bond for our MC.